All right, now we're going to demonstrate how to use the naloxone in a vial in order to administer to a patient. So first thing you'll need to do is confirm that indeed it is naloxone hydrochloride or naloxone HCl, and take a look at the expiration date, and we would prefer it be unexpired. We'll pop the cap off, and that cap is clean but not sterile, so if at all possible, grab some alcohol and clean off that site. Preferably, your patient's site has also already been cleaned and prepped. We'll then take a syringe out of its package and the first thing we'll do is tighten the needle on it and sort of push-pull back and forth to make sure the syringe works. We'll pull back 1 milliliter, which is the volume of drug we're going to use, and pull the cap off, pull it straight off. When the vial on the tabletop or a flat surface will go through the center of the rubber stopper and inject a milliliter of air. We'll then turn the stopper over, and adjust the needle so that the tip is below the fluid level inside the vial, and draw back on the syringe. There'll be a little air pressure that will draw back as well because you injected a milliliter of air into this. And when you get the full milliliter out, you can stop. It's perfectly okay to take all of the drug into it. If it gets a tiny bit more, it's not a big deal. Okay? We'll then remove the needle from the stopper or from the vial. And you want to push up on the plunger to get rid of big air bubbles. A small amount of air will not hurt your patient. Okay? Then we'll go to the site we've already chosen, and at 90 degrees insert into the patient and inject the drug into the patient. You'll come out. If your device has a safety on it, you'll activate the safety. If it does not, you'll do a one-handed recap, if necessary, and snap it from below. Never put your finger above the top. And it should go into a sharps container if at all possible. If you've got a sharps container immediately available, you don't have to use any of the safety devices. You can put it straight into the sharps container. You then pull a Band-Aid out. If the patient's bleeding, you have a cotton ball, piece of tissue, and put a Band-Aid over the site. You'll monitor the patient, and in 3 to 5 minutes, if they're not responding, you can repeat this. Now we'll show you using a prefilled naloxone. Now, these are commonly found in hospitals. They may occasionally be found in the community setting for this. You'll notice that we have it in 2 different colors. The color does not matter. Please look carefully at the product. Both of these have the same NDC number, same stock number. So we'll open the package at the open here spot and slide the pieces out. We'll remove the caps, attach the plunger, remove the cover for the needle. If at all possible, we've cleaned the site. Again, we'll go in at 90 degrees and inject the full volume into the patient. When you're done, you can either resheath with a one-handed technique or preferably into a sharps container. Naloxone prefilled syringes are also available, and you open the box at the open here end and remove the cap from the plunger and remove the cap from the needle, 3.5 turns, just like the other one, and then remove the top. You'll see these have a lure lock, and we can place a needle on it. Again, we recommend a 22 or 23 gauge 1-inch needle, and we can use this intramuscularly just like we've done before. Or instead of the needle, we can use the mucosal atomization device, and the mucosal atomization device allows for us to spray this in the nostril. So this styrofoam piece will go into the nostril, and you'll inject half of the volume in one nostril, and then pull it out, go to the other nostril, and push the other half in. And just like all the other techniques, we'll reassess this patient in 3 to 5 minutes and can repeat the dosing.
The Evzio Autoinjector is an intramuscular device that comes in a package of 2. That's important for your kits, that you have 2 doses for a patient, so it comes ready to go in that regard. What's interesting about this device is that it speaks patients through the complex system of injecting naloxone. So we're going to let it speak for itself. First, I want to point out that this trainer is white and black, whereas the actual device is purple and yellow, so it'll look a bit different. And also that it only speaks in English. So for your non-English speaking patients, it may not be as advantageous.
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
Now we're going to take a look at the newly approved Narcan nasal spray. This comes conveniently packaged in a container of 2 doses. Remember, with all of our formulations, it's important to provide 2 doses in case the first is not sufficient, so that another dose can be provided a few minutes later before EMS arrives. With this newly approved Narcan, you'll notice that the box has some convenient directions in the case of an emergency to direct a patient in its use. When we open the box, we see 2 individually packaged Narcan doses. All you need to do to get this ready is simply open the foil. You'll also notice we don't need a sharps container or any body parts, fake arm or thigh, to demonstrate this, because it's simply injected straight into the nostril. You don't need to put half in each nostril. You simply identify one of the nostrils, insert, and spray.